Welcome students to the series on Introduction to Constitution. This video aims to cover the provisions for standard of living, nutrition and public health. Let us begin by what are the provisions for standard of living, nutrition and public health. So in Article 47 of the Directive Principles of State Policy, it states that the state shall regard the raising of the level of nutrition and the standard of living of its people and improvement of public health as among its primary duties, and in particular the state shall endeavour to bring about prohibition of consumption except for medicinal purposes of intoxicating drinks and drugs which are injurious to health. So this provision is necessary because health becomes a vital factor of human development, and development is the basic ingredient of any socio-economic progress that we might have. One needs to be healthy, one needs to be take care of his well-being to be able to participate in any of the socio-economic or political activities that we have to take under for human development. For example, if a person is not well enough or is does not have adequate nutrition to say get employed or to go to school, it hampers his entire human development for the rest of his life if he's not able to nourish himself at that moment. So, health is a vital indicator of human development, and in India, the right to healthcare and protection has been recognized since early times. Independent India had approached the public as the right holder and the state as the duty bound primary provider for health of all. So, it ensures that. It is the right of the people to secure adequate nourishment, to secure adequate health, and it is the duty of the state to provide it. So, with that context, our country has been welfare state in particular regard to healthcare, because healthcare is such a multiplier in our lives that it has the capacity, along with sectors like education, to bring people out of poverty, to raise standard of living, to raise their nutrition, and it is all interlinked by itself. It is cyclical. If one has adequate food, one has adequate nourishment, he can get adequate education. Once he gets education, he can get adequate employment, better employment, he can nourish himself even further, he can nourish himself better, he can take care of his family, and that is how a cyclical progress or development we can see. So ensuring that people have right to food, people have enhanced standard of living, enhanced nutrition, and that their public health care needs are taken care of. So by public health care we mean that there are some societal issues that hamper health of people, such as unhygienic conditions or prevalence of diseases, or currently there's a pandemic like COVID. So in times like these, in situations where we have a prevalence of certain diseases that are hampering health of people at large and not affecting just a few people, you need the state to be able to take care of the people. Hence, there's a provision for it under Article 47 in Directive Principles of State Policy, which makes it the duty of the state to provide for any sort of healthcare or nourishment or policy or legislation necessary to ensure that people's health is not getting affected negatively. There, all these schemes and legislations work towards improving the nourishment and standard of living and not hampering it. This has been also an international concern of India because India was a founder member of the United Nations. It has ratified various international conventions promising to secure healthcare as a right for individuals in society. So it was not just the state as a domestic duty of its citizens, but India is also very much aware of its international commitments, of its international obligations to provide for people in terms of providing for adequate level of standard of living. So, what are some of the legislations through which we see that the Indian state is working for the health rights and healthcare of its people and raising their standard of living, nutrition, or public health? It's through food security, for example. So, food security is an act that provides food and nutritional security in a human life cycle approach by ensuring access to adequate quantity and quality of food at affordable prices to have people live with a life of dignity. So by that, it's essential to focus on the three A's. So one person needs to have access to food. Once you have access to food, it should be available to him. Once it is available, it also needs to be affordable to the person. So there are three A's that we need to focus on. First is availability, second is accessibility, and third is affordability. So even if there's food available, even if I see a pile of food grains, I need to go to that pile of food grains, and I need to be able to be afford to buy those food grains. It can't be expensive for if I'm a person or if I'm a poor person, I need to be able to afford it. So all these three A's, that is availability, accessibility, and affordability, needs to be taken care of, and the Food Security Act provides for just that and ensures that uh, the food is provided in a very inclusive manner. No person goes hungry because the food that is being provided is being affordable, it's accessible, it's given through the public distribution systems, PDS system, which makes sure that the food is accessible to the neediest of them all. So the PDS system is established in every other district, in every other gully, and through that system is where we may ensure that the food is accessible to people. Then there's a scheme called Ayushman Bharat, which provides free access to healthcare for 40% of the people in the country. So this ensures that out-of-pocket cost of healthcare doesn't go up. It ensures that the government subsidizes healthcare for the poorest of the citizens and ensures that they can go to hospital, their needs are taken care of, they can access healthcare in a way that is very much affordable, and the government will provide for such free access. Then there are also various insurance schemes by the government which aid and assist the medical needs and costs of the neediest of the people. And these provisions, under which Article 47s have been implemented, it has been done in a variety of ways. And the schemes have worked towards improving public health, healthcare, increasing standard of living by focusing on health of the people, because it is so essential. Health of a person is very vital to his well-being for whatever lifespan he or she may have. So healthcare is the first way in which a government or a state can provide for the well-being of its people. So this is the provision under Article 47, and we have covered this provision quite a bit of detail. So Article 47 aims to secure the public health of Indian citizens through food, health provisions, and affordable healthcare. And this has been a short summary. Thank you, students.